Hello, my sweet peeps. It's Monica, otherwise known as Sleeved After 60. I haven't done a video in a while because I was having technical difficulties. I had to go and talk to a 20-year-old who helped me. And so I'm back, and I hope that I'll be able to be a little more active. First of all, I'm still pre-op, and my weight, I weigh myself on Fridays, and I decided that I'm going to have that number out there, not because I had any issues with telling it, but because since I'm talking about doing this in order to have sort of a timeline, that I think it's important, and it's just a number. So I weigh myself on Fridays. I'm 223 pounds. I'm almost 5'5". When I do yoga, I'm 5'5", but when I don't, I'm 5'4", 8 or something. Anyway, so as I had mentioned last time, I was going to see the nutritionist because the psychological evaluation came back saying that due to my past eating disorder, which was binge eating disorder, that I needed to have more time. I needed to have 3 additional visits with a nutritionist because when I went for the psych eval, I was very honest, and of course, I told her that I still struggle with overeating, obviously, duh, which is why I'm a good candidate for the surgery. So anyway, I told her that I'm still having some issues, a couple of times a week, that I overeat. I don't necessarily binge like I used to, but I do still overeat. Obviously, when you're 5'5" and you weigh 223 pounds, you're overeating. But that is, that's the rule. So anyway, I went to see her on Tuesday, and I have 2 more appointments, the last one being like the second week in December. And I see the psychologist again on December 19th, at which time I hope that that I'll be cleared. So it might be in January. I didn't necessarily learn anything out of the ordinary seeing the nutritionist, because I've done that before when I went to treatment and I saw a nutritionist for a long time. But one of the things, of all the things that she wanted me to work on, is that she would like for me to have an extra fruit every day, which is interesting because I've been cutting out fruits, getting ready for surgery. What do you want? I mean, if it's not one thing, it's your mother. So there you go. So anyhow, so there we are. What I did kind of want to talk about today was about anxiety. And I don't know how many women who have eating disorders or weight issues, how many of us have anxiety disorder? I, for one, do. And as I have mentioned, sorry, I'm coming apart over here. Let me see. It's Minnesota. It's the fall. I had to bring out my sweaters today. Oh, God, if you're in California, God love you. I'm glad you're there. But we're getting ready here for 30-degree. Anyway, I do digress. So anxiety. So as I had mentioned, I retired from a very stressful job almost 1.5 years ago. A year ago, June 12th. So I had been in medication for a long time for anxiety because anxiety was just at times out of control. And once I retired, I thought, oh gee, the issues having to do with work are over. Talked to my doctor and decided to go off medication. Now, I'm not really sure if that's exactly when I went off or if I did it before that, because of course I am not a very compliant client or patient, so I don't keep track, and I'm not always great about taking, my medication. Actually, that's not true because I have those little thingies, and I do take my medication every day. But I don't. I probably non-compliant isn't the primary issue. Maybe the issue is that I don't have a good memory. But so I don't know when. But about maybe 2 weeks ago, I think 2 weeks ago on a Friday, maybe, I had an anxiety attack, and I've had a lot of anxiety, but I hadn't had it to that extent. And at another time, I'll talk about some of the anxiety, or some of the stressors in my life now. But they're not your regular stressors, when you're in your mid 60s. Or at least I shouldn't say that. For me, in my mid 60s, my stressors are very different than what they were in my 50s or 40s or 30s or 20s. So I sort of had kind of an awakening of, oh my, you have to do something about this. So I got a hold of my doctor and went back on medication. And interestingly enough, of course, I feel now 2 weeks out, or maybe it might have been a week, I'm sorry. That's what happens, when you're retired, every day is Saturday, so I lose track of time. So anyway, when I went on medication, by now, the want or the need to eat, to snack, to graze, is not what it was 2 weeks ago. And so I'm grateful in a way that happened. But one of the things is that as much as I know about anxiety, as much as I know about mental health issues, as much as I've had issues with anxiety, I still want to be normal, or to be not have to take medication. And it's not even about normal or abnormal or not normal, but I think it's more of the sense of I can take care of this, which I think fits into also my eating, that somehow I should be, I'm smart enough, I know enough. I mean, when you go on YouTube, or when you, the people that I'm following, we collectively, we know so much more than most of our doctors, and individually we know so much more than most of our doctors about nutrition, because we've been dealing with this our whole lives. I can't say that I've met a woman who was overweight who said, oh, I didn't realize calories, carbohydrates, no, I didn't know that. Most of us, at least those of us that end up in places like YouTube, we tend to be pretty well educated about what we need and what we're doing. And just my own experience has been that for some reason, even though in my head I know that it's a brain thing, whether it's anxiety or overeating, that it has a lot to do with the brain, I still sort of think that there's something wrong with me, that I should be able to do this. I should be able to not eat. That I should be able to, to tame this beast, which of course is what gets me in trouble every single time. Because as I've said before, I've been thin many times. I've lost weight many times. I just haven't been able to keep it off. And part of that is that I lose weight, and then that eating disorder just wakes up and starts, knocking on my shoulder. And before I know it, I'm eating, unconsciously eating, and my weight goes up again. And then it's the shame and the worthlessness and all that other stuff. So I think that although I don't have that shame about my anxiety, I don't think that I'm doing something wrong, and that's why I have anxiety. I think that I'm doing something wrong, and that's why I can't control it. Because look at you, you're retired, you're in a good relationship, your kid is okay. So what are you anxious about? Not acknowledging that I know better, and that I know that it has nothing to do with that it has to do with my brain and how my brain operates. And anxiety is one of those things that I have to deal with for life. And when this happened, whenever it was 2 weeks ago, I have to say that it really hit me hard, because I do have some issues with perfection. And I also have issues with being very independent. I always have been. I've always been independent. I've always taken really good care of myself. I've always been very responsible. And it's like, how come I can't do this? Why can't I do this? What am I doing wrong that I can't do this? And that's what I struggle with, and that's what makes me uncomfortable. And when I have to be faced with it, and have to get help for it, it stings. It still stings, because then it's a double whammy. So back on medication. It's probably going to take a few weeks to really see a real difference. Everything annoys me, and I'm annoying. I don't even like myself right now. I mean, as far as, being annoying, because when you first, go on the medication, it doesn't work quickly. But the good thing is that I know that I can come here and there'll be 10 other people that will say I have issues with anxiety. And although it doesn't cure it, doesn't take care of it, I know that it just is. And it's something that I need to deal with, and I need to, be patient with, and self-care. And that's just, how it is. So at first, when I got the news, that I couldn't get a date, I think that that's what pushed me kind of over the edge, because not having a date, a surgery date, made me more and more anxious, because I have no control over it. I'm not used to doing that. I'm used to being really very self-sufficient. And when you're self-sufficient, you take care of business and you take care of what needs to be. So waiting around is difficult. And I guess I'm going to learn some kind of a story, or a lesson, not a story. I'm going to learn a lesson from all this, that that sometimes you just have to wish for the best. So anyway, that's where I am today. I'm hoping that I'll be able to do these more often. I've got some things that I wanted to talk about, and I'll do them on a different video. So ciao for now. Bye.